people know that several days of rain in a row or months of snow can make people depressed, but did you know that could even happen here? Yeah, it's called summer seasonal affective disorder, or SAD. Chip Coffey, the director of therapy services at St. Luke's Behavioral Health Center, is here with us this morning. Good morning.
Good morning.
We're glad you're here to talk about this because, you know, I certainly feel it. You're just trapped inside your house for, in this case, 2 weeks on end. We've been under a heat warning now. There's not much you can do. How's this affecting people?
Well, what we see, and it's just like the blizzards back east, is that we have this kind of this bank of heat and sun that we just cease to function outside. So what we see is we have people kind of different than winter SAD. What we see is people who have kind of increased activity at night, but depression, agitation, frustration, sleep loss, all of those things that then kind of lead into some classic depression. So it's something that we have to approach every summer.
Oh, yeah, I guess you'd have to be careful if it can lead to depression. Are the symptoms then, it sounds like a little bit the same, but a little bit different than the seasonal affective disorder in winter months, I guess?
Well, in winter months we see weight gain, and summer we'll see weight loss.
Okay.
And winter people will have a lot more sleeping, whereas in the summer there's the lack of sleep. And really this, in the later evening times, this kind of this desire, this urge to do a lot more activities, when really we should be kind of shutting down in the evening times.
I see irritable on that list. I don't know anyone who isn't irritable in this heat. How do you know when it's a problem, though?
It really is when it starts to impact a lot of relationships, when it starts to impact, you know, basically every waking hour is being frustrated, irritated. I mean, I think all of us, we open the door and the heat hits us, we kind of grouse a little bit.
Right.
But this is that extreme of that, and just really not able to tolerate any of it at all anymore.
And women and children are especially susceptible to this? That's
what we're seeing in about 1% of the population. So, you know, a little bit more we see it in winter seasonal affective disorders, about 5%. So we know a lot more about it. We don't know as much about summer season.
So what do we do?
Well, some of the things we talk about is really having a sleep routine.
Okay.
So regardless, making sure to get the right amount of sleep. Exercise, activity, things like that you can do. And I really recommend going to yoga classes or going to exercise classes indoors where you can be with other people, because a lot of it's social isolation.
Yeah. Yeah, I guess that is true. You're not seeing a lot of folks out on the streets or on the golf courses this time of year.
Right,
Yeah.
and in those extreme cases, people will need to get treatment. And sometimes it can be medication, sometimes it's therapy, going in and getting proper assessments. Those are so important because, you know, we have to decide, is it going to be just a summer seasonal, or is this a chronic depression that needs to be treated a different way?
Good subject to know more about here in Arizona. Thank you so much for being with us this morning.
Yeah, who knew? It's interesting.
Yeah, good advice. It feels so good to get into the gym and work off that.
You get those endorphins running, yeah.